I'm Dr. Manuel Astruc. I'm a board-certified psychiatrist. I help entrepreneurs who are suffering from depression get back to being energetic, productive, and very confident. Transcranial magnetic stimulation is a 10-year-old technology that's been FDA cleared to treat major depressive disorder that has failed to respond to at least one medication. And what I want to talk about is the gap between the FDA-approved indication and what insurance companies are currently covering. And to tell that story, it's important to go back historically to before insurance companies approved any treatment. There was no regulation, and doctors would order tests or medications or hospital stays, and insurance companies would pay. This led, unfortunately, to some abuses of the system. And some of the abuses were fraudulent. People would order tests or have hospital stays that were not indicated. There was flat out fraud. But there was also times that doctors would order a test just to be sure, right? Let me get a CAT scan or an X-ray just to be sure that something's not going on. There were also times that it was convenient to order a hospitalization. So before you had surgery, you could come into the hospital the day before, be admitted, have your blood work done, get ready, and be on time for your surgery without admission that was not necessarily medically indicated, but it was convenient for a lot of the parties that were involved. Or after surgery, rather than kicking you out and sending you home right after surgery, you could spend a day or two in the hospital recuperating and resting without having to go home and fend for yourself. It was also not unusual that a patient with a complex situation would be admitted to the hospital for a workup, quote unquote workup. So that's where the treating doctor would order a bunch of tests, and they would order a consultation with colleagues. So the neurologist could come in, the cardiologist could come in, the kidney doctor could come in, like all the colleagues that might be involved in trying to figure out what's going on with the patient would all be available to treat the patient and to talk to each other. Incredibly convenient, right? But a costly way for an insurance company to use their scarce resources. Nowadays, these workups are done as an outpatient, so patients get scheduled for their tests. They get scheduled with different specialists. And most of my patients these days, they're not that happy with the communication that falls through the cracks when this is the way that the world has evolved. It's just a function of the fact that the scarce resources, having a patient in a central place, having the specialists gathered around them, have changed, and doctors are incredibly busy, and it's just hard to get the communication that would be ideal for most of our patients. As a result of these problems, the next set of medical insurance companies started to have what they called gatekeepers. So they would be individuals who would be paid, so part of the medical costs now went from just between the insurance company and patient care to someone who would oversee and manage the patient's care, these gatekeepers, and they would be asking questions. Are you ordering this test for a reason that we agree is needed, or we don't really think this test is needed, for an MRI, for instance. Medications, they would make determinations as to what medications they preferred for a patient based on costs and effectiveness, and they would have step therapies. So what's very common right now is that if there's a medication that is branded, it still has not gone generic, that's a more costly medication. And they also get promoted and marketed, people hear commercials. And the older medications, which are still effective, the insurance companies want them to be used, these generic medications. Patients often are hearing from family members, from the television, from their therapist, oh, you're on an old medication, no wonder it's not working, you need a new one. But the insurance companies want you to step through 1, 2, sometimes even more generic medications before they'll authorize one of their more costly branded medications. Now, the reality is, in my opinion, is that the older medications are generally and often just as effective as the newer ones. They just don't have the marketing dollars behind them at this point. Some of the newer ones do have some advantages. So for instance, with the atypical antipsychotics, the newer atypicals are effective as are the older ones, but the side effect profiles are better. Less sedation, sleepiness, less weight gain potentially. But because of a limited amount of resources, there's only so much money, the gatekeepers decide how they're going to be allocated. Now, how does that translate into the prior authorizations for TMS, transcranial magnetic stimulation? The FDA says one failed medication and TMS is now indicated. Insurance companies want a patient to have stepped through an algorithm of prior treatments before they will approve transcranial magnetic stimulation. So in general, what the insurance companies are looking for is evidence that a patient has been on 2 to 4 antidepressants in the past and that they have failed them. They want them to have failed treatment with 1 or 2 courses of psychotherapy. And they want the depressive episode that the patient is having to be severe. Like a more moderate or mild level of depression, they will not authorize. So there's a gap then between what the FDA has approved and how the medical insurance companies are approving transcranial magnetic stimulation. In my opinion, it's not unreasonable to have a patient try medications first, if the patient wants to. One of the areas that I struggle with the decision making is the indication that the depressive episode has to be severe. There are plenty of folks who have moderate depression that is clearly causing distress, clearly causing problems in their functioning, but it just hasn't gotten to the point where they are completely debilitated. So someone still working just barely that could benefit from a treatment, but it hasn't quite reached the threshold where an insurance company says, now it's severe. And the severity is rated based on standardized rating instruments, which are basically questionnaires that you have to go through. And based on the score that you get, you have mild, moderate, or severe depressions. Finally, what if you don't meet criteria for depression? As we've talked about, the criteria for depression, you've got to have symptoms that are present for 2 weeks or more that are causing, a significant amount of distress or impairments in functioning, and there's a laundry list of 9 symptoms. You've got to have 5 or more of these symptoms. What if you only have 3 of those symptoms? You no longer meet criteria for major depression, but you can still be having a significant amount of distress. So in that instance, TMS can still be helpful. However, it would be off-label, and it's unlikely that we'll get an insurance company to pay for that, even though it could still be helpful. And one of the areas that I'm incredibly interested in continuing to pursue treatment with transcranial magnetic stimulation is in burnout. So burnout is not depression, but will often lead to depression. And the people who are having problems with burnout are suffering and not able to be productive at work, right? The criteria for diagnosing burnout: exhaustion, cynicism around work, or loss of interest in work, and lastly, losing your effectiveness at work. So only 3 criteria. And entrepreneurs, business owners, executives, like, you cannot afford to not be productive, focused, creative, and showing up at work. That's what your company needs from you. But TMS is effective in this category, but it's completely off-label. Insurance won't cover it.